Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
I thought I'd bring to your attention. One is for the men and one is for women. The first one is if waking up to pee is disrupting your sleep, simple lifestyle changes often help. And they talk about the uh, fact that the what is technically called nocturia, which means that you got to wake up at night to go to the bathroom to urinate, uh, is something that should not occur, but probably at most once a night, and it goes beyond that. It's called nocturia, and it affects a third of males who are over 30. And uh, and they talk about ways to try to reduce the likelihood of this occurring, and they talk about the fact that uh, if you have to get up at night, that means that you have too much water in your bladder, which you can address by not drinking before you go to bed at night. And uh, Sometimes polyuria, or the increased urination that occurs when you have diabetes mellitus, can be one of the reasons. And so you can get your urine tested to see if you have sugar in your urine. Uh, but the commonest reason is because you uh, drink too much fluid. And then, of course, there are medications that the doctor could give you that might increase the likelihood of your urinating. Diuretics, hydrodiarrhea, and those kind of drugs, Lasix, and other such drugs that are part of the management of high blood pressure. So that uh, the fact that you have to get up at night may mean that you have a lot of urine accumulating in your bladder, or it may mean that you have an enlarged prostate, and that because of that, your bladder capacity is smaller, and therefore you urinate a lot, particularly if you drink a lot of fluids before you go to bed at night. So that anything that would cause you to accumulate fluid uh, and then have all that fluid go into your bladder could be the reason. But uh, another cause is you could have a urinary tract infection. So this is another reason that it could occur. And this, if you had any problem like this and you have uh, frequent urination at night, then of course you can check your doctor so he can evaluate you and get a PSA and other things to make sure that the prostate is okay. Then, of course, the bladder, uh, you may have a urinary infection or other conditions that cause you to have an overactive bladder. Uh, uh, Nocturia, or urinating at night alone, is not uh, does not require does not mean that you have a disease, but it's something that's worthy of, if you're a male, it's something that's worthy of you having your doctor evaluate you to see if your prostate is okay, if your bladder is okay, or if you're just drinking too much fluid. Because the easy remedy is to stop drinking a lot of fluid. So if you had no fluid for hours, for about 3 or 4 hours before you go to sleep, then it's likely that if the problem is too much, drinking too much water, then that would eliminate it. So So that's something that is for the most part a problem for males that the males should be aware of. Any comments or questions about that? Yeah, about the
Dr. Callender, I notice you're talking about males, but females, I know I drink a lot of fluid, and so that probably is the reason why I do urinate a lot at night. But I drink a lot of fluid all day long, so I don't do that too much in the daytime. So is there a difference? Just the fact
yes,
of sleeping or
yeah. There's differences that if you drink a lot before you go to sleep, then it's possible that you would wake up because there's a lot of urine in your bladder. So sometimes it could just be from uh, drinking a lot of fluid. In that case, all it would require would be for you to, for 2 hours before you go to bed, to not drink anything.
but if I drink fluid all like that all day long, I don't urinate frequently during the day. So what's the difference in day and night?
And the difference day and night is that most people do not urinate more than once at night, even though they drink a lot of fluids.
Oh, okay.
Yeah. So, so we're only talking about those who have nocturia. That is, you wake up at night because you have to go to the bathroom to urinate.
Yeah. Okay. Yeah, well,
Yeah.
Uh, yeah, I drink a lot of fluid, but I try to front load it. What I mean by that is I try to drink most of my fluids before 2 p.m. And so um, that doesn't mean I stop drinking after 2 p.m. I just don't drink a lot after 2 in the afternoon. Like for dinner, I'll drink about a half glass of water rather than a full glass. Um, but one of the real keys for me for avoiding nocturia, where I sleep through the night without getting up at all, is a couple of things, and that's sometimes you wake up because you're thirsty, and that's not good because just waking up at night and you don't get a full night's sleep, you don't feel rested. And so I make sure I'm hydrated during the day so I don't wake up thirsty at night. The other thing, I find that when I'm outside, I'm getting my vitamin D from sunlight, I'm walking, I'm running, and I lift weights. The resistance training. It doesn't have to be a lot of weights, but that's guaranteed that I stay asleep for the whole night. I don't get up at all.
Thank you for sharing, John Buchanan.
My internet connection is not very good, but it seems like maybe a conflict a little bit because they say drink a lot of water. Um, I try to do that during the day. I hadn't thought about what Darryl was saying. Don't drink too much at night. Don't drink too much water. But it's strange as a diver. We're drinking water all the time. Got to hydrate. That's one of the bottom lines of diving because of the exertion that you're doing underwater. Practically every part of your body is moving, is challenged, is burning up calories, and you get dehydrated. So they said, and one of my themes is think water, drink water. What is good for you. But and I might wake up once a night sometimes, but it's not a big deal.
Okay.
Doctor gave me.
Thank you for sharing. Once a night is not thought to be excessive, but when you go beyond once a night, it is definitely thought to be a nocturia, and digestive changes should be taking place. Okay, any other comments?
Yeah, Charles Davis. I mean, I periodically I could be going 5 or 6 times a night. I never, my sleep. I'm not sleeping. To be frank with you, yeah, and no, I mean, mm-mm.
Well, you probably uh, when you get up more than once a night, it suggests that either you're taking too much fluid, or your bladder's smaller capacity, or your prostate is larger, or or you may have other conditions that associated with uh, uh, nocturia. Of course, when you have 5 or 6 times a night, that suggests that it should be studied to find out why, because that's not normal. Okay. The next article was an article that's probably more applicable to some of the women in the group. Uh, what do you do when you find out that you're over 50 and your bones are thinning? Uh, uh, and this is not unusual for women who are over 50 after the menopause, uh, osteoporosis and osteopenia, the terms that we use for that, which if it persists will result in getting bone fractures. And so it's important. Darryl mentioned getting enough sunlight, getting enough vitamin D, getting enough calcium. He mentioned something else that is very important, and that is weight bearing. Weightlifting is very important because your muscles help your bones. And so weightlifting is a important something. And then, of course, take more calcium, more sunlight, more vitamin D. And then one thing that you wouldn't think would be related, but they recommend that you stop smoking or vaping because that causes the bones to break down, osteo, uh, osteocytes to break down, and your bones get thin. So, of course, what this means is that you probably should have uh, bone density testing when you get over 50, particularly if there's any suggestion that you uh, have any thinning of the bones. And so a bone density test will tell you whether or not you need to have special treatment to avoid the osteopenia and osteoporosis that will result in uh, hip fractures. Uh, and then, of course, the other things after menopause, there is hormonal therapy that can also be helpful. So, but a lot of it starts with the bone density check to see if your bones actually are thin or not. Any comments or questions about the problem of thinning of bones that can lead to fractures, which cause all kinds of problems? Carol and then Dr. Perez.
I know the first time I broke my arm, well, it's only once, and my doctor immediately gave me the bone density test, and which I had lost uh, the density I've gained. Well, anyway, so he put me on a pill, and then he put me on Prolia, which is a shot every 6 months. Told me about the resistance training that I should be doing all the time, starting with the rubber bands or just a small weight, which I do now to help strengthen the bones. And it has greatly improved. And he said, because women that go through menopause should be aware of that. And he jumped on it right away. But so now I'm taking a shot every 6 months called Prolia to help with the bone density problem.
Thank you for sharing, Dr. Perez.
Likewise, I'm in year 4 of my 5 years of being treated for osteoporosis. And last year, my daughter gave me a weighted vest for my walking. And my Howard educated rheumatologist um, was very happy with that and with my improvement.
Thank you for
So
sharing.
for your Christmas list, put a weighted vest on.
Thank you for sharing, Joyce.
Yes, during our previous conversation on this topic, I had discussed with the group about my concerns about my test results from my bone density test. And the doctor had placed me on on a pill medication. And the pill medication just aggravated my system so that it was decided to take me off. And I was going to try to concentrate working with physical therapist, not a physical therapist, a trainer to increase my bone stamina. And then I had a fall, and I fractured my wrist and sprained my other wrist. And my bone density test showed that my bone structures were lower than what they wanted them to be. They were not in the critical stages, but they had noticed that they were getting a little worse each year. And we talked about it, and I want to thank you guys for encouraging me to go along with the doctor to take the in flute and for my bone density. And I'm waiting now to get the results back from the doctor giving the okay from the manufacturer to start using the medication. So I will say in a couple of weeks I will be starting my infusions. So thank you so much.
Okay, thank you. And then a final article for those of you who wear glasses and also wear contact lenses. Uh, Eye doctors say wearing a contacts in these situations can lead to infection. So if you're swimming, they suggest that you take off your contacts. If you're showering, they suggest you take off your contacts. If you're sleeping, they suggest you take off your contacts. Uh, and these are conditions that the ophthalmologists believe that may lead to eye infection if you continue to uh, leave your contacts in place when you're doing those things. So those of you who have contacts, take note. Dr. Perez?
I'll wait. Does anybody else have? Because I wanted to applaud Sister Joyce because I do remember that conversation. And when we follow through, when we go to the next step, I I appreciate that, and that encourages and ignites me to move forward as well. So I congratulate you on moving forward.
And thank you very much. And I am going to look at the weighted vest because I do a lot of walking, especially with my little pooch. So I will invest in a weighted vest. Thank you for that recommendation.
Hey, Dr. Tatum?
About what we were just talking about. Well, that completely slipped my mind. Okay, I'll come back to you later. Okay.
Okay, John Buchanan, you had a comment?
Yes, for a while, I was wearing contact lenses, and I got tired of taking them out at night, and I would leave them in overnight. And the brand that I had was they said it was okay to sleep, and I got an infection, and I had to go to the ophthalmologist, and he said, "Do not sleep with the contacts because uh, had he not caught the infection that I had, I could have lost my sight." So very important to use anti hair to keep the germs out of your eyes and not wear them at night. Thanks.
Dr. Tatum?
Okay, now I remember. I went to my ophthalmologist trying to get contacts because I hate the glasses. I still do. And I noticed he was wearing his glasses. And I asked him, aren't you, why don't you have contacts? And he mumbled something or another. But I'm thinking, how come my ophthalmologist is prescribing contacts for me and he doesn't wear it? And listening to you, and he did mumble something that they're really not good. And then one time I got my contacts stuck in my eye and I couldn't get it out. And they reassured me that this happens frequently. I was so embarrassed. I just gave up the thought of wearing contacts. But if a doctor, ophthalmologist, he's not wearing it, he's prescribing it for everybody else. And I started thinking, why wouldn't a doctor wear it himself if it really enhances and is so much better?
Thank you for sharing. Okay, if there are not any more comments, I guess we can start the articles. This is an interesting article that many of us already had decided that bridge employment is better than full retirement, because when you say full retirement, people think you mean you're not going to do anything. And people who fully retire and do nothing usually accelerate death. And so this article just confirms what most people have already concluded, in that if you retire from one thing, then go to doing something else that is more fulfilling for you. So not doing anything is not a good prescription for longevity. But having doing something that you enjoy, or something that you've always wanted to do, uh, uh, is a good way of trying to live as long as you can, to have a quality life. So, and this article just confirms that uh, full retirement is not a good idea unless you are going to retire to do something that you've always wanted to do before. And in that case, it's not, they call it a bridged mentality. I'm sorry, bridged retirement, or temporary retirement, which, any comments about that? I'm sure many of you out there have thought of retiring. Oh, I have retired. Any comments or feedback? Darryl?
Yeah, I just always thought it was a great idea to have your retirement plan in place before you retired for what you're going to do, because you just can't sit around and do nothing. And so, it's great to ease into it so that you test the waters before you actually retire. Like I knew I wanted to be a musician, entertainer, and so I started setting those wheels in place before I actually retired. And like the benefits of being retired, if you can work it that way, is that you determine when you want to get up, how you set your schedule, but at least you're free that way. You're not locked into that 9 to 5, but you got to have something to do to keep your mind occupied.
Thank you for sharing it. Uh, Mark, you had a comment or? Okay.
I'm sorry, my hand for some reason isn't working, but most women don't have to worry about retirement because we still working, taking care of the house. So
Okay. Thank you for sharing that opinion. Mark Tatum?
Doing it
Yeah,
anyway.
yeah. Hello. I just wanted to say that Darryl is my retirement hero. I want to be like him when I grow up.
Okay. All right. Okay. All right. There are no other comments. We'll go to the next article. And the cyclospora outbreak is now confirmed to be from the parasite cyclospora, which is in lettuce. Taco, they identified the taco place as the place where the lettuce that's packaged is has been the source of in 5 states across the United States. So uh, so they have done away with uh, Taco Bell's lettuce, packaged lettuce. So there's hope that this will result in a decrease in the outbreaks, which are located in at least 5 states, and of course, Maryland and Virginia are part of the states that are involved as well, but not as much as the Midwest. Any comments or thoughts about this? Any concerns where you are located? Uh, but anyway, it seems as though they've traced it down to the lettuce, and hopefully this will stop the outbreak. Okay. This next article is not going to be popular, but it talks about 3 foods that they recommend eliminating from your diet. And I know John Buchanan won't like the first one, which is bacon. Uh, and then, of course, the second one is white bread. And then third one is the wonderful French fries. So they're suggesting that a good way to uh, have long life is to eliminate those from your diet. Uh, uh, any comments on those 3 foods that they suggest eliminating?
I have a comment, Doc. What is it about the French fries that makes them so bad? Because they're just potatoes, right?
It's the way they're prepared. I forgot what compound it is in the French fries that's so objectionable. But the way they're prepared, they mentioned the compound that makes French fries so undesirable, but they don't include that in this article. Dal, do you know what is about French fries that makes it so objectionable?
I'm with John about the bacon. What? What? And especially my husband. He definitely at least 2 to 3 times a week eats bacon.
I had some this morning.
How much can you eat?
I guess the French
Well,
fries are very tasty.
yeah, it's the problem is coming from the grease that it's fried in. So you have triglycerides. Um, the cheapest way to fry anything is in beef fat, beef suet, And anything that you want to avoid in beef for heart health comes through in the beef fat. Um, there's the alternative is to use seed oils. Um, as far as like what's least expensive for a restaurant owner is the beef fat. Next least expensive is seed oils, but there's a lot of problems associated with cardiovascular health and seed oils. The best way to do it is to fry it in an avocado oil, but that's the most expensive, and most restaurants don't do that. So wherever you're getting fries, it's being fried badly. Uh, Unless it's in some top-end restaurants, top-end vegan restaurants that use avocado oil. But even most of the vegan restaurants are trying to cut corners and they're using seed oils. So it's generally not a good idea to get French fries anywhere.
It tastes so good. Okay, EOS one.
Dr. Callender, what about preparing your French fries at home?
I don't know. French fries uh, are not thought to be uh, good wherever you make them.
Yeah, but if you're going to do it at home, use avocado oil.
Okay, and then one last thing of the white bread. Go over the factors again of the white, because one article says something about the wheat bread wasn't as good for you either. I don't
No,
know.
no. Whole wheat bread is preferable to white bread. Yeah,
Uh-huh.
yeah. That's
I
preferable.
had,
EOS one.
I was going to just say I had something kind of funny on this.
EOS, I think
And
EOS one was first. So let her, I don't know what your name is. EOS one.
oh, this is Catherine. I was going to say I had something funny about the food. And I said, well, white is not right. White sugar, white rice, white bread, white white flour, all of that. Leave it
Yeah.
alone. Potatoes, white potatoes, all of it.
Okay. Thank you for sharing. EOS one.
Main reason why any like white bread, white rice is not good for you because the fiber is stripped out of it, and so now you just get a carbohydrate that the fiber reduces the rate of absorption in the body, and it absorbs right away, raises your blood sugar level, and you don't get the fiber, you don't get the germ, um, and off when you eat something that lacks fiber, it increases your hunger and it leads to overeating.
Mm.
Okay. EOS one, you had something to say? You're on mute. You're on mute. You're on mute. You're on mute. We can't hear you.
Oh, all my questions have been answered.
Oh, okay. All right, Janice.
Yes, we talked about bacon also being bad for you. Darryl, I'm asking you because I know you're quick with looking this stuff up. Does it make a difference if it's fried or fixing bacon in the oven? I love bacon. I never fry it. I cook it in the oven. So to me, I'm pulling the grease off, or is that my imagination?
Uh, I don't think there's anything that they can tell
That
you
doesn't help me
positively
at all.
about bacon.
Mhm.
It's
Bacon is
interesting.
just bad. Is that it?
Yeah, bacon and French fries are delectable, but not good
Mhm.
for you.
Okay. All right.
Um,
All
you you had something else, Janice?
No, that's it.
Joyce?
I was going to ask about the air fryer. Is that a better option for cooking the bacon and the French fries?
Uh, I don't know if there's a good option for bacon or French fries.
Okay.
Okay.
I think Joyce might agree with me. When you put it in the air fryer or oven, you're pulling that grease off. And I said, okay, I've done a good thing. But Dr. Callender says it doesn't make a difference.
Well, I haven't read anything that says that
Yeah.
that it makes it healthier. Darryl, have you come across anything that says the air fryer makes it healthier?
Okay. Oven baked versus pan fried bacon. Oven break Oven baked bacon is generally healthier. Um, when you're frying, the bacon grease has nowhere to go. When you're baking bacon on a rack, the grease can drip away. As such, you tend to consume less grease when you bake bacon. But as far as the nitrates that are a problem, that's going to be present in all bacon, and that's the main thing that gets you, the nitrates. So it's better. Don't think that it's okay to eat bacon just because it's oven baked. If you want to protect your cardiovascular health, you just need to give up bacon. Air frying is better. But if you're air frying bacon, it's still the same problem. You get the nitrates. So forget about bacon. Don't try to find a way to consume your bacon habit. It's just like heroin. It's like crack. Let it go.
You're so unkind.
Wow,
But
Darryl.
you can air fry the French fries, but you got to develop a taste for that because you can season it all you want to, but it's not going to be that satisfying French fry that comes from frying that bad boy.
So delectable too.
Let it go. That sounds mean.
Okay, all right. Thank you for sharing. The next article is a very interesting one because blindness is such a global disease, and in this article they talk about how the poorer the country is, the more likely you are to go blind, and they talk about the preventable causes of blindness, and many of them are preventable. Of course, the infectious ones, glaucoma is probably the leading cause of blindness in the world, but and then of course um, the other cause and so forth, and macular degeneration, and of course glaucoma, which we as a people seem to have more than most other ethnic groups, along with diabetic retinopathy. So that and they're saying that really the real issue with blindness, which is so prevalent across the world, is the fact that they don't have money to go to the doctor, and they don't have enough eye doctors, and uh, as a consequence, people go blind for reasons that are often preventable. And of course, here in this country, we have a lot of problem with macular degeneration, and of course, cataracts is a easy, easily treatable cause of blindness that can be eliminated. But the number one cause globally is trachoma infection. Uh, but for the most part, it's an economy problem. Those countries that have low income are the ones that have the biggest problem with blindness. And so all eye doctors, they think if they were more globally present and we had better incomes across the globe, that would play a major role in decreasing. In addition to which, of course, malaria is also a cause of blindness as well. Dr. Perez?
With the issue of physicians and physician shortages, um, uh, the president of the National Medical Association presented before Congress about the anticipated deficiency of physicians and the attack that this administration has had on DEI, specifically Black medical schools, and the training of Black and Brown and people of color in medicine. So we're talking about it globally, but we know that in this country, when anything impacts the general population, it's devastating to us. So the absence of physicians, the absence of Black physicians, the absence is going to have the greatest impact on us and globally people from the African diaspora. So it's not anything for us to close our eyes on, but we have got to. We have got to turn this thing around.
Any other comments on visual impairment across the globe and in the United States? Okay. Well, this is the next article, which is an article that is really not very helpful because it doesn't identify what is a high risk APOL1 genotype. And I suspect that what they mean is where you have two APOL1 genes, and that if you have two APOL1 genes, that you have a lower creatinine clearance than if you didn't have that. And so there's much missing in this presentation, but yet there's enough to suggest that we really need to study the APOL1 genotype so we can do a better job of identifying exactly what genotype is associated with the decreased creatinine clearance and which genotype isn't. They don't go into detail on this, but but most of we just had a transplant Congress, and most of the information suggests that there is a segment of APOL1 genotype people who are more likely to have decreased kidney function after transplantation. And it would be better if they would identify that so that you could know exactly what they're talking about. Right now, they have kind of masked it so you don't really know exactly what they're talking about, although most of the presentations have not really identified how badly the APOL1 risk is, if it is at all. Darryl?
Is this something? Is this something you can be tested for if you've got
Yes,
kidney disease in your
yes,
family? Okay.
it's a genetic test. It is really associated with the same gene that knocks out sleeping sickness in Africa is the same gene that is associated with glomerulosclerosis, uh, FSGS, which is a common disease that affects people of color in the United States. And so when you get this genetic testing, they're able to identify whether you have one or two APOL1 genes. If you have two of them, then it's suggested that you may be more likely to have decrease in your kidney function before or after donation or transplantation. So there remains a lot to be done and a lot to be clarified so that this paper is just doesn't just say that if you're Black and you have two APL1 genes that you shouldn't donate because the article is vague enough to leave that question unanswered. But it's a study that is going to need a little bit more clarification as time goes by, so we know to what extent who's safe to donate, who has the APL1 gene and who is not safe. But it is a genetic test that should be done on all potential donors. Any other questions about this? We're finding genotyping and genetic testing to be helpful in many areas. Transplantation is just another area that it's helpful. And I think as we do more studies, we get more information. We're better able to understand what's going on. Any other questions about this, which still require further studies to clarify this issue, particularly as it relates to Black kidney donors? This is an article that talks about a constipation drug that is good for depression and brain fog, which was not intended to be. It's a drug that's treated for chronic constipation. It just so happens that when they used it, people who were depressed got better. And so they realized, and so they're going to have to do more studies to find out how we can treat more depression with this particular drug. So it's an interesting observation. With time, it's just like Viagra came about in treating hypertension, and they found that it helped the penile function. So similarly, here's a prucalopride, which is chronic constipation treatment that is good for brain fog. So it's an interesting observation. Just needed to have more studies so that it can be approved for depression as well. Any comments or questions? Darryl?
When you can't stink, you can't think.
Thank you, Darryl. Okay. Okay, let's go to the next one. I thought it was an interesting observation that they found the association without meaning to. And this is a good article following up on the recent outbreak of cyclospora parasite. And they're telling you how to clean your fresh produce. And the bottom line is that water, simple water and brushing is all you really need. You can use bicarbonate if you want to, but for the most part, just water and brushing is all you need. You know, we've always not needed soap. Just when you get your grapes or whatever produce you get, you wash it off before you do anything. You wash it off with water, and that's probably the first thing you do when you get your produce, fresh produce, home. Any comments about this? I think that may have been something that our parents did automatically when they brought things home from the store, is to wash it off. Dr. Perez and Darryl.
Darryl can go first.
Oh, I'm sorry. I didn't really mean to raise my hand, other than this article is saying you can trust produce that says it's been pre washed. Some of it says triple wash. I don't trust it, but the article says you can trust it.
I wouldn't either. And none of our parents did. They automatically washed it. First thing they did when they brought it home, they washed it, ran water over it, and then they prepared it for eating. Okay.
I have on that. I've been trying to, and this is before the cyclosporiasis.
Paralysis.
Psoriasis. So, right, exactly. Cyclosporiasis. I was doing some of the experiments that I had seen, I guess, online, because of how quickly, especially my fruit, berries, would spoil. And I started, and the recommendation that seemed to work the best for me was to take strawberries, all berries, and put them immediately in an airtight container, taking them out of the container that they were in. And I've been going away from plastic into glass. So I lined it with a paper towel and put them in there, and then wash them before I'm getting ready to use them, because it was the moisture that I was led to believe was the reason why my berries were rotting so quickly.
Thank you for sharing, EOS one.
I was just wanted to say I have my own garden back in my yard. So when I take them off, I just wash it with water and a little bit of baking soda. That's it.
Good. That's what they recommend as well. Right. Darryl?
I need to take my hand down.
Okay. Then all the comments. The next article is one we've had similar comments, is that smoking and alcohol are common risk factors for breast cancer and atrial fibrillation. And they're saying that combination of smoking and yes, smoking and what's the other thing? Yeah, vaping and
Alcohol.
alcohol. Yeah, we're more likely to be associated with breast cancer and atrial fibrillation. Interesting. Nowadays, the younger kids vape and the older people still smoke. It's amazing that smoking is still practiced, so common. Uh, and vaping is in the younger ones, and the older people do smoking. And the association with alcohol and smoking with breast cancer and fibrillation is hard to ignore. And these studies make you think twice about both of those things. Smoking is obvious, and vaping is obvious that they're not good for you. Alcohol, I think more and more studies are documenting that alcohol is dangerous. Dr. Perez and Darryl?
Darryl can go first.
Okay, smoking has warning messages on all tobacco products. Can kill you. It could damage your unborn child. And alcohol has no warning levels, but this article is saying that alcohol intake demonstrated the strongest link to breast cancer and atrial fibrillation among the 4 risk factors. So obviously, alcohol should have strong labels, and it doesn't.
Is that coincidence or cause?
That's we have the best politicians that money can buy, and the alcohol lobby, which is very strong, and our culture for alcohol is very strong, and so they want to defend it, and they don't want to put labels on it, warning labels.
It's unfortunate. But one of the things that bothers me is that so many people are still smoking, and in spite of the labels. So, yeah. Okay, Dr. Perez?
I have never had a patient, especially one who was addicted, who wanted to be there.
Okay.
So when we talk about smoking, in many instances, we're talking about addictive disease.
Yes. Alcohol similarly. But
Exactly, alcohol. So we, again, in other cases, we don't blame the diabetic or the asthmatic. Food for thought. So if we have if we have a marketing system that's targeted to go after the least of these to get them addicted, and then we blame them for their addiction.
yeah. So true. So true. So true. Yes. Yes. But then what is interesting is that we don't even address the alcohol addiction. Yeah. But well,
What
we
did
got
we see? You talked about, and I've been looking, especially with the World Games, filled with alcohol commercials.
yeah.
And how many people who enjoyed that time saw it as a break from all that's going on around us, and want to get back to feeling that goodness, that happiness. What do they call it? They call it collective effervescence. I bet there will be a spike in addictive disease following this at a time where things are so crucial. Yet we know that, but we're not going to do anything to change it.
Well,
let the commercials begin. Let's get our addicts for the next 2 years. Yes.
Thank you for sharing, Dr. Perez.
They call it happy hour.
Happy hour, yeah. Well, okay. I think you said it all. Okay. Let's go to the next article. Catherine, you had a comment?
I was just going to say, my daughter had a drinking problem, and she ended up needing surgery for hip replacement. And I think, I'm trying to see, knee, I think too, she ended up. But the doctor told her that unless she went through this program at the mental health center for alcoholism, he would not do the surgery. So she had to go through that program. That was an outpatient program before he would do the surgery to replace her hip. And I guess that was one of the contributing factors to her having such a poor hip situation, because when I looked at the x-ray for her hip, you know how a chicken a chicken leg has that round part at the top. Hers was like a diagonal straight across that wasn't there because it was so deteriorated. But I thought, well, at least he's thinking more about her entire self and not just what he needed to do to help her with her physical problem.
Very true, because delirium tremens is a lethal complication for people who have not withdrawn from alcohol. So hats off to your doctor, your daughter's doctor.
Probably an NMA member. As the,
Well,
as the
I don't know.
national, go ahead.
I don't know about that, but I do know she was in the public health system at the time.
Yeah.
The National Medical Association is getting ready to have its convention and scientific assembly. And I know this is a commercial, but I'm pleading for your prayers and your blessings as we get ready to meet. These are some of the greatest minds as it relates to our health that we'll be gathering. And it's important for the members of the association to feel the energy of the community for which we advocate for. And I would appreciate it.
Thank you for sharing. EOS1, you had a comment?
Yes, I was wondering, what do y'all think about the new non-alcoholic drink, or something like ARK that they have commercials on? Not that I drink, because I don't. But I was just wondering, anybody know anything about that?
I don't know anything about it. Anybody familiar with it?
I would just say,
They showed it.
yeah, I would just say, think about some non-cocaine crack.
Well, I was just wondering because it was a commercial and it said no alcohol, no things. It's a drink bottle. And I was just wondering.
Yeah, I'm sorry, can't give you any information on that one.
Nobody seen the commercial?
Yeah.
Okay.
Non-alcoholic drinks are for non-alcoholics.
That makes sense.
But
okay.
I don't have any experience, so sorry, can't give you any ideas on that. This is a study that is interesting because this is a potential drug that will decrease the need for cataract surgery. And it's a new eye drop, and time will tell whether this will decrease the need for cataract surgery. If proven effective, it would be a major breakthrough, because now if you've got cataracts, you're going to need cataract surgery, period. Whereas this is supposed to decrease the likelihood of the cataract maturing and occluding the vision. And so this will negate the need for surgery in many patients if you make the diagnosis early enough. So we'll watch this and see what happens, but it has potential to be a major breakthrough. Yeah, John Buchanan?
Yeah, so a ton of my friends have had cataract surgery, and I'm just wondering, does anybody have the symptoms of cataracts, and is that just a factor or a situation that happens when you get older? Is everybody going to get cataracts, or what do you think?
Probably about 90% of the aging population. has cataracts, but different stages of cataracts. And some people go through life, and even though they develop cataracts, they never mature to the point of obstructing the vision. And so in those people, this might avoid the need for cataracts. But it appears that probably about uh, something close to between 70 and 90% of the people who reach 90 will probably need cataract surgery. Any other, Catherine?
I was going to ask, um, is that a surgery that you can need more than one time?
Uh, Theoretically, once is enough because all you're doing is the lens becomes opaque and you can't see through it. So you just take out the opaque lens and put in a lens that you can see through. So once should be enough, although there are people who need more than one lens replacement, but usually one lens replacement is enough.
There again, I'm sorry can't do my hand, but I do have cataracts, and my doctor has been monitoring them. The last time I went earlier this year to see my doctor, he was surprised at how well I read the chart and what he saw looking at my cataracts. He was saying that, I need to start thinking about cataract surgery, but he really was surprised at how well I was still able to read the chart. So, but my question is, this study is just getting started. How long will it take before it's approved? So maybe I can wait.
Yeah, it sounds like it's worth waiting, but doesn't say exactly when it will be FDA approved because they have to do more phase 3 studies
Oh,
to which will probably take 6 months to a year. But
it's not bad.
uh,
Okay.
but based on what your doctor said, you don't need to be in a hurry.
Yeah, based on me, I'm not in a hurry.
You're blessed. Darryl?
Yeah, factors that can increase your risk for cataracts include genetics, if your parents have had cataracts, diabetes, smoking, excessive sun exposure, and prolonged steroid use. So, for us walkers and runners out there, getting our vitamin D, got to be careful to wear sunglasses with UV protection.
Thank you for sharing. Pearl? Pearl Lipscomb? Pearl, you had a question? Okay, I guess. Can't hear us? Okay. Well, let's go on to the next article then. This is an article that is very important. Uh, grapefruit, grapefruit juice is very desirable for many. What isn't desirable is the side effects that it has on medications that we take. And so, if you're gonna, if you like grapefruit juices, which are good, then you should be mindful of the medications you're taking because a number of them are inhibited by grapefruit juice. And so, if you're a grapefruit drinker, uh, fruit eater, then you should be sure to check with your doctor. Certainly immunosuppressive medications and some other medications are inhibited by grapefruit juice. So it's something to keep in mind if you're a grapefruit drinker. Mark?
Yeah, I discovered this a few months ago, and I was highly annoyed with that. I'm currently on BP medicine. It was amlodipine,
Oh, yeah. Yeah.
which I've heard is common for African Americans. They say it has good results,
Yeah.
African Americans.
Yeah.
Um, but the side effects, grapefruit interferes with that.
Yeah.
And I'm just thinking, I would love to switch the two. I would love to just eat or drink grapefruit juice in place of my medication because I heard grapefruit, it helps with blood pressure and hypertension and things like that. But the two can't be in the same system at one time. Um, so I've switched to another BP, but I would love to find more natural fruits and homeopathic remedies instead of being hooked on medications. That's just my 2 cents.
Thank you for sharing. Darryl?
It mentions don't eat grapefruits if you're taking statins, and it also should include blood thinners. It 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 doesn't work well if you're also taking blood thinners. Mark, you may want to consider if you're on amlodipine, you may want to switching to some other blood pressure medicines because we share some genetics, and you may find that if you're experiencing any side effects from the amlodipine, like increased tiredness, you need to switch to something else.
Any other comments? And just take note about the grapefruit because it's uh, very, I guess there are a lot of people who love grapefruit juice. So uh, this may cause you to stop drinking grapefruit juice or switching other medications.
Mm. Dr. Callender, I remember you told me that you shouldn't drink grapefruit when you're taking your medicines. So that stopped me from. I love grapefruit. I eat eat it or drink the juice, but I don't when anywhere near time for me to take my medicines.
Thank you for sharing. Good. Okay. The next article is about daylight saving time. Oh boy, have we talked about daylight saving time and permanent standard time, and the fact that heart attacks and strokes and automobile accidents occur more often when we have daylight savings time. And so there's still a big debate about which is more important, the daylight saving time or the permanent standard time. And so far, it's tough to those who argue one way strong, and those who argue another way are strong. Uh, so this article presents both sides of the argument, and it looks like the House is going. Now, what will happen in the Senate? Will it be daylight saving time or standard? I guess time will tell. What are your thoughts about it? What are your thoughts about it? Daylight saving time and anybody care?
I don't really care, but I do have a friend that has problems driving her eyesight. She has problems driving at night. So naturally, when they switch back, it, it, she she is she has a problem as far as job, if her job is further away from her home, she has to leave work early enough to get home before dark and stuff like that. But fortunately, I don't have those problems, so doesn't
Any
really
other
matter.
comments?
Say that again.
Any other comments?
Oh.
Yes, Dolores.
I like the time we're on. It works for me. That's it.
What is your question?
I just had a comment that I like the daylight savings time.
Okay. Well, as you can see in this article, it talks about the fact that you have more accidents, you have more heart attacks, and you have more. That many consider that as unhealthy, but because of the fact that it is associated with increased heart attacks, increased automobile accidents, and for that reason, people do not favor daylight standing time. Those who are opponents to it. So, and that kind of debate is something that has been going on for at least a decade or two now.
Yeah.
You have any thoughts about it, Dolores?
I guess I just got used to it. It doesn't affect me
Yeah.
anyway.
Yeah. Yeah. It's just a certain percentage of people who it does affect that way. John?
Yes, I was wondering why the daylight savings time affects accidents and the heart situation you were talking about.
Yes.
And just as a side, it affects me if I'm on a gig and the gig is 10 to 2, and then at 1 o'clock the time goes back to to 12 o'clock. That messes me up a little bit. So anyway, so
Yeah.
what's the relationship though with the accidents and the heart attack?
Well, they say in the article that the body does not react well to a change of an hour like that, and that because of this, people need an hour more of sleep. And the absence of this is the reason why you have more automobile accidents and why you have more heart attacks. And because the body is not capable of adjusting to that hour difference. Just as Dolores has mentioned, some people, it doesn't matter to them, but there's a certain percentage of the population who are very sensitive to it. And as a consequence, they have more automobile accidents and more heart attacks. And that's the reason why they favor standard time over daylight savings time. But it's interesting, you have two strongly opposed groups who have strong reasons for favoring whatever they want to do. And so you see it passed well in the House. The question is, what's going to happen in the Senate? Joyce?
I don't live far from the deadly highway called 210. And we do have quite a few accidents and several deadly accidents out here. So if the daylight savings time change into the other um, daylight saving time will help, then I'm all for it. If it means having fewer accidents out here on 210.
Thank you for sharing. Any other comments? It's going to be interesting to see what happens in the Senate.
The oneness with the world because nobody else is changing their time.
Well,
Well,
Trump is all
yeah,
for Trump is all for
And so,
daylight savings time.
yeah, one of the problems I have is some of the states don't change when
Yeah.
everybody else changes.
Yeah. Yeah, that's right. Yeah.
Like Arizona, I think doesn't go. And if this bill passes, does that mean we stay on daylight savings and don't change?
Yeah,
We
that's
don't.
what it would mean if the Senate
Okay.
goes along with the House. Yeah.
Okay.
But
But the issue is the change. It's not the time as much as the fact that there is a change.
yes,
So we would expect that those things we associate with daylight savings time, that's because of the change, not because of the time that it is, correct?
yes, yes, the change. Yeah. So, but there are other, as I think I forgot Dolores mentioned or somebody mentioned, there are people for whom the daylight savings time is a blessing because they have more daylight.
Mhm. Mhm.
And just like her friend who would have to leave early
Mhm.
because of the standard time, which would have more darkness, and that segment of the population would be disadvantaged, and a lot of people who have night blindness, by the way. So
Mhm.
there's a segment of the population that they would be concerned.
And if you have kids, you can get them to bed earlier than normal.
Okay. Joyce, did you have something else to say? No? Okay. All right. This next article talks about how much sleep do you need to have if you're over 60. And it talks about how that 7 to 8 hours is what is desirable when you're over 60, uh, and that your brain needs that time to recover from your daily activities and to metabolize the toxins that are produced as a consequence of daily activity. And so you need at least 7 to 8 hours to allow your brain to recover from that. And so uh, those who don't get 7 to 8 hours uh, don't get refreshed adequately. And so their brain function is not as good as those who get the 7 to 8 hours that are necessary. Mark, you had a comment?
Yeah, so I was reading some light research about how historically mankind has been on, and I'm forgetting the term. It's we take sleeps and we take sleep in shifts. Um, the whole notion of a 7 or 8 hour block was, and someone could fact check me on this one, but it was invented by the people who make mattresses. Um, and it was around the time where they made the uh 8 hour workday, where they made that kind of mandatory, at least here in America. Um, but the fact is, like, when you let your body just naturally wake up and sleep as necessary, they say a lot of times during the night, historically, it would be that people would get up in the middle of the night, and this is why, they say like 3 o'clock is that weird, hour where people would get up in the middle of the night and not know what to do. But they would say people used to be productive. They would write books, they would uh, practice their craft, or be with their spouse, um, and then go back to sleep for another shift before daylight hours. So I've been really into that. I've been really trying to look into that. And use especially using that time. If I'm getting up in the middle of the night, there's a reason why I'm up. It could be to pray. It could be to pray and to meditate and that sort of thing, and then we'll read and go back to sleep. Um, But I think there is some truth to that as well as, and if you don't have that luxury, or actually the luxury of taking a nap during the day, I think that helps. So I can agree that, 7 to 8 hours total is good, but I think that block that you're talking about, that probably needs to be looked at a little bit better because it probably isn't all in just one block, is throughout the entire day.
Darryl, thank you for sharing.
Yeah,
Darryl.
yeah, that's called bisegmented sleep. And rather than being invented by the mattress companies, it's really a product of when we have the electrical grid, we can stay up longer at night. We can go to bed at 10, 11, 12, or whatever because the lights are on. Before we had the electrical grid, we had lamps, oil filled lamps, kerosene lamps. So before electricity, people typically went to bed shortly after when it got dark. So that may have been 7 o'clock on the average. And slept for 4 hours, 4 or 5 hours till around the midnight hour. And that's when you get the term wait until the midnight hour. And then it was social time. It was social time and sex time. When you got up, you stayed up for an hour or two. If you went to bed at 1 or 2, you slept another 4 hours and got up when the sun came up. But just looking at the research, are you better off with uninterrupted sleep for 7 or 8 hours or bisegmented sleep? The research says that you're better off getting that solid stretch of sleep for 7 to 8 hours, 7 to 9 hours, that you're better off during that than bisegmented sleep. There's some other sleeping patterns that are different. If you look at historical beds, they're much shorter than they are now. Where you lay out flat, and that's because in the past they used to sleep with almost in a sitting up position, where there's big pillows are stretched across the bed, and so that your back is elevated 30 to 40 degrees. Uh, but you get more restful sleep. You have fewer back and neck problems by laying almost flat. You need a little bit of elevation on your neck, on your head to prevent sleep apnea, but actually we're doing it better. And our modern sleep is better than ancient sleep by getting that solid stretch of sleep from 7 to 9 hours and sleeping with your body flatter than we used to do in the history. So in some aspects, our sleep is improving, comparing it to ancient sleep.
Okay. Any other comments about that? Because I think it's 10:30. So any closing comments? Dr. Tatum or Darryl or John?
I just saw an article, or actually a podcast by Neil deGrasse Tyson, saying that if aliens came down to Earth and they would see us spending so much time laid out on mattresses, that's something to think about.
Well,
something else to think about is that all animals sleep. And it's not, like fish, sharks, they say that sharks keep swimming. They do, but they shut down a hemisphere of their brain. And the only hemisphere that they have active when they're in sleep mode is the one that keeps them moving, and so that water can pass over their gills so they can get oxygen. But all insects, and the reason why we sleep as human beings is it's not only to restore cognitive function to let the brain rest, but it's also animals that you deprive them of sleep, their digestive system will just self-destruct, and that's all animals. And so sleep is important. We don't get it, our bodies will fall apart.
Okay, may God be with all of you until we meet again next week, and thank you for being with us today.